Hi, my name is Sidhu, and we have a very special guest today. And the guest's name is Dr. Raj Dhingra. Welcome to our show, Dr. Raj Dhingra.
Thanks for having me here.
Dr. Raj Dhingra has a very impressive resume. Dr. Raj Dhingra started his career in India. He was a general practitioner in India for 22 years. That's a long time.
That's right, yeah.
And then when he came to the United States, he moved into the holistic approach, which is being a acupuncturist and a chiropractor. So tell us a little bit about both chiropractic, being a chiropractor and also acupuncture.
Yes, Mr. Sidhu, first of all, thank you very much for having me here again. And after practicing many years in general medicine, so I always had a passion to do something different and integrate it well with the medicine.
Right.
And as the research progressed further, it was proven beyond doubt that combining the holistic medicine, integrating it, alternative medicine with the mainstream medicine gave better results. So after moving to America, I decided to get myself trained in the alternative medicine. With the intention of that, I enrolled myself into 4 years degree course in National University of Health Sciences.
Right.
And I am now a licensed chiropractic physician practicing in Hinsdale area. And then I further trained myself in acupuncture over 1 year. And at this point of time, I am providing the pain management and started a low-cost, affordable clinic in Hinsdale providing the acupuncture.
Well, Dr. Saab, I'm calling you Dr. Sahib because in India, somebody who's very learned, we call them Sahib, and which you are a learned person. Tell us, that what are the kind of patients who are coming to you right now? I mean, are they people that you're treating with pain management, or the people coming from all different walks of life that you're treating for different ailments and different illnesses? Or is it mostly about pain?
Most part of the my practice is the pain management in geriatric population. Geriatric population means the elderly people, and many of them are being referred by the neighborhood physicians. There are certain pain. Sidhu Sahib is a very complex subject. Technically, pain is a socio factor, biochemical factors, mechanical factors. We have pain while sitting in a bad posture. We have pain of the aging, like the geriatric population, aging population. They have all kinds of arthritis everywhere. They are, I mean, for any motion, it hurts them. So acupuncture I am providing along with the pain medication. Researchers have found that acupuncture works in many other conditions as well. It was discovered about 25 years even before Christ in China, and then they used to do it with the very blunt objects. As the things reported getting better and better, and during the 18th century or around, like the Chinese under their rulership, they compiled it into a specific standardized program.
Sure.
And compiled into some kind of a book.
Right.
And now that in 1997, it became popular when President Nixon, went to China, and one of the reporter got sick, and he had to have a surgery for the appendicitis, and they did it without putting him to sleep, without any anesthesia. So since
that
then,
was in 1997?
That was 1972. In 1997, then the World Health Organization recognized it for so many ailments like sinusitis, allergy, headache, side effects of the chemotherapy, backache, arthritis, whole degenerating conditions of the body, and along with the general well-being. So then nobody discovered that the acupuncture, which is involved in like Sidhuji little tiny needles into the body, and stimulating the points. And it is supposed to be some kind of a vital energy or chi, which is supposed to be running in your body, and they want to unblock it from certain points. But as it became mainstream in America, after President Nixon encouraged it to look into it, and when in 1997 WHO gave the recognition, and 1999 NIH gave the recognition. NIH is a very vital agency of America. So the doctors started looking results even in conditions like of the elderly, where there's no pain, but still the people reporting better, like people have numbness and pains in the elderly, or any kind of a neuropathy, they call it, like the disease of the nerves. And despite having the medication to just control the pain, people have to take so much of the medication in such a heavy dose that they feel dazed all the time.
Right. Feel
It is,
groggy when they wake up. They can, yeah.
it is very difficult for them even to be in an arousal state for most of the time at a
Right.
dose which it works. And then
Can't drive, can't go to work
obviously
properly.
they feel, and those medications lead to fall risk, increased fall risk. Elderly fall at home, and then they break their hips, and the whole cascade of problems, pain, medication, side effects of medication, and then back to the square one. So acupuncture is like very like non-invasive. No.
So younger people also get this done, and
Absolutely, although it's not exclusively for the
Older
elderly people or geriatric population. It was meant for. It started as a pain medication, but now the disease is, as I said, that acupuncture is, as more and more research happened. Basically, now the scientists did not stop short there only for what the Chinese feel. They started interpreting in their own terminology, in their own understanding, how the brain circuits get like affected by the acupuncture. As after the genetic coding of the brain was done, of the body was done, now after recently scientists have done the brain mapping,
right.
and they discovered so many hundreds of the new circuits. And now they believe, all the scientists believe, that the acupuncture is supposed to be affecting the neural circuits of the brain, and it is neuromodulating the pain. You have the pain, but the brain is receiving the pain in a different perception, and
So-
it is giving instructions to the body, so as to they take care of the pain, they relax the muscles, that pain is less, and no medication is taken for that.
So people who have had sports injuries in the past, let's say somebody who had a sports injury at the age of 18, it seems that, and I've heard a lot of people say that the pain went away for a few years, but then when they got older, when they came to the 40s or early 50s, that pain came back.
Actually, that any injury is supposed to leave an impression of that some kind of abrasion on the bones.
Right.
So any injury, if not appropriately controlled at that time, either by physical therapy or resuming the exercise program, is likely to induce an early arthritis.
Right.
So, regardless of that, you are asking me that we drifted a little bit other way, that do the younger population also have? There are so many diseases of the younger population. Acupuncture is supposed to be effective without the medications.
Right.
Like migraine is so common in the younger population, and it is supposed to be excellent in the migraine treatment. Then this allergy, the seasonal allergy, asthma, and then they have the epilepsy, and they have the.
So this all can be treated with
They
acupuncture.
get under control without the medications.
Oh wow, that's
We have
very
seen
nice
so
to
many
know.
patients of the migraine that they do get better, and the incidence of migraine becomes less and less and very infrequent. And the younger population of today's world, where we are so much in social media, younger or old, all are on social media. They are either on the in front of the computer screen,
Right.
or on the cell phones,
And they're constantly lack of exercise.
and they are the ones who are developing the early
Right.
spondylitis, cervical spondylitis. They have upper back pain, they have lower back
Stenosis.
pain. Eventually, it leads to stenosis. Although stenosis is supposed to be the condition of the elderly,
Right.
but as you said that all these previous bad habits, bad posture, and unnecessary, unusual and prolonged exposure to the bad posture by watching the TV leads them to early spondylitis, early arthritis of the spine, and again, the choice is between the medication. It's not that the acupuncture is becoming mainstream in America.
Oh, it's the right way to do. Like,
Every hospital, every clinic, whenever they say that medication is a trade-off between the benefits versus the risks.
Yes, yeah.
So whenever they say that the medications have, when the doctors say,
there's always
commonly they
side
say,
effects to medications,
Right.
because then they have it in fine print that this could be the side effect of taking this particular tablet.
no medication is without any side
Side
effects.
effects.
Every medication, everywhere, every doctor has a trade-off between the benefits versus limitations or the risks.
Right.
When
That's
the
why-
benefits exceed, then they say we have no choice. But when they say that they are leveling off or the side effects are getting more, every doctor is saying, okay, you may try acupuncture. The
Well, this is
idea is
great.
that it is non-invasive.
So it is designed to prevent, like you said, asthma or cure asthma or treat asthma.
Absolutely. And migraine.
Migraine
And it has
headache.
been seen that people who are on periodic, maybe even once a month acupuncture, they have less number of the incidences. Acupuncture is supposed to be so good in fertility. Many these gynecological clinics are offering the acupuncture for infertility.
Oh, wow.
And it has been known that now acupuncture is helping everywhere, even in unconventional fields.
So, for our viewers, we'd like to inform you also that we have asked Dr. Dhingra to help us, create a segment every week uh, to talk to you about pain management and how you can control that pain that you may be having or one of your loved ones may be having. So, Dr. Dhingra, is there anything else you'd like to add to what kind of other treatments acupuncture can help with?
Yeah, as we were talking about the pain, acupuncture is not the only exclusive modality for the pain. I am doing a lot of pain medications by pain management by acupuncture. There are distinct things I like about it. It is totally non-invasive, without even giving even the herbal medications, without even the botanical medications, because every supplement or medication will have some side effects. Only thing out of the all modalities which we use or many other physicians use or everywhere it is used, it could be physical therapy, it could be myofascial release, it could be chiropractic manipulations, for which we are graduating hundreds and thousands of the doctors in this country, which is commonly popular in America or some parts of the Europe and the Australia. And America is the number one in number of the chiropractic physicians. They enjoy most of most of the scope of the practice, as is the conventional doctors. So, as we agreed that we'll be working together in initiating a program week after week. So we'll be taking one topic every week. The focus of course, the pain aspect of that and how it can be controlled. Though we will be doing this acupuncture. The only thing in acupuncture that the negative effects of this is this: many people cannot afford the way the rates are set up for the one visit. So I have added little philanthropic angle to this, that I am running a very low cost affordable clinic for the acupuncture.
That's correct, because you have helped a lot of people, including people that I know and their family members, and you've given them advice. And this is something that you've done.
I have my belief, and I have my mission statement for my clinic is this: when acupuncture added to the modern medicine, you expect better results.
Right.
You come to my clinic. I am basically trained in the modern medicine. I practice modern medicine most of the time. I am just like going in a little alternate direction, a little different direction now, just to make it like for the last 10 years or 12 years, I am running this clinic. Sidhu Saab, I have never seen any patient who would say I am not even benefited a little bit.
So see, the thing is, you are a learned person.
They do get benefit. Of course, it is a time-consuming process, but in the first visit, like we do, in fact, take the whole history, physical, and take their medication, reconcile their medication, and then eventually when we give the treatment session. After that, periodic session don't take that much of time, but we will be talking about, and the best of all, even the research proves by the natural hormones it secretes in the body, it is considered even for a general wellness as a preventive effect, as a main system of medicine for the prevention of the diseases, because it increases the natural good hormones, feel happy hormones,
So
like the steroids of the body. It secretes. This is how endorphins they are called. This is how that it can even work in the depression, because it secretes its own good hormones in the body.
Wow. So you can treat.
So you are
depression
giving
as well.
me an opportunity, and we will work together. That we will take, like every week, we'll take one topic that where it can help, and how by the general wellness and general home exercise program you can get better and get better results.
So, Dr. Dhingra, like I said before, while I was introducing you to the audience, that you're a medical doctor.
Absolutely.
And then you became a chiropractor.
Absolutely.
And then you also are doing this holistic approach with acupuncture.
Yes.
So, which makes me believe that you are very, very learned in pain management.
Thanks for
Right?
that.
And who would know better than a medical doctor which works better, right?
Yeah, absolutely.
So-
right. So the any chronic disease, the aim and mission should be to help the patient at the cost of minimum side effects.
That's wonderful. So,
And that is the principle behind any chronic. And we are all, as the technology advanced, the lifespan of our population has increased. Obviously, that comes with the price. We are all having arthritis, pains, aches, body aches, aging, neuritis, all kinds of things, diabetes, and disease of the chronicity, disease of the old age. So we are going to dealing with that. So anything which gives help. So my mission at this point of stage of my career is to help the people to know that there are alternatives for everything. And we are not saying that this is the exceptional, this is the only treatment. We are integrating with the modern medicine.
well, thank you so much, Dr. Dhingra. And stay tuned for a weekly session with Dr. Dhingra with Outland Media News.
Thank you very much. Appreciate for having me here.
Thank you.
Thank you very much.